So when you think about freedom, what comes to mind? Probably things like freedom of speech, right? Or the right to vote. But what if I told you the most basic freedom of all, just the freedom to live, isn't actually guaranteed? We're going to dive into a story about a historian whose brush with death it put the whole idea of American liberty on life support.
All right, let's set the scene. It's 2020. The whole world is dealing with the pandemic, and right in the middle of it all, the well-known historian Timothy Snyder finds himself fighting for his life. He's in an ICU at Yale, battling a nasty case of sepsis, an infection that his body just can't shake on its own. He's got machines breathing for him, he's hooked up to everything, basically surrounded by the absolute best that modern medicine can throw at a problem.
So, he pulls through. He recovers, and you'd think his first reaction would be gratitude, right? Relief? Nope. Not even close. He was furious, just filled with rage. And that's the big question, isn't it? Why? Why would somebody who was just saved by a medical miracle be so incredibly angry?
Well, as he was lying in that hospital bed, it hit him. A really profound realization. All of it, the machines, the top-tier doctors, the fact that he was even alive, none of that was guaranteed to him as a right, not as an American citizen. It was a purchase, a simple transaction. He lived because he had this incredible insurance from his university that could buy that level of care. And the flip side of that is terrifying, right? Without that insurance, the story could have ended very, very differently.
And that's where the story gets so much bigger than just one person. Snyder's experience, it's like it cracked open a window, giving us a peek into this massive system. And it's not really about the individual doctors and nurses trying their best. It's about the very bones of the system, the structure of how we get care, or, as it turns out, how we get denied care. He called it the architecture of denial.
Okay, look at this, 1.2. Just a number? What could that possibly mean when we're talking about healthcare? Well, the answer, it's pretty chilling.
That's the number of seconds. 1.2 seconds is the average time a medical director at Cigna spent to deny a claim without even opening the patient's file. They were using this automated system, and get this, over just 2 months, that system kicked back 300,000 claims. It's a perfect, if terrifying, example of how the system works, right? Your fate isn't being decided by a doctor at your bedside. It's being decided by an algorithm, basically, and that algorithm is designed to optimize for one thing: profit.
And believe it or not, this same kind of thinking goes all the way up to the highest levels of government. Think about a government shutdown. What keeps running? The functions of power, right? Congress still gets paid. The White House keeps the lights on. Judges are still serving. But what gets shut down? The functions of care. Things like food assistance for new moms and their kids. That freezes. Critical clinical trials for sick people. They just pause. Food safety inspections. Sorry, not essential. It sends a really clear message, doesn't it? The system is built to protect power, not to protect people.
So, okay, that's the situation here. But how does this all look when you compare it to the rest of the world? Let's zoom out a bit and just look at the hard numbers, because they really do paint a picture. And honestly, it shows that the US is a major outlier.
Check this out. In the US, we're spending over $13,000 per person on healthcare. That is literally more than double what countries like Japan and Canada are spending. So, for all that extra cash, you'd think we'd get better results, right? Nope. We actually have a lower life expectancy. And then you look at that last row, medical bankruptcy. In places with universal care, it's just not really a thing. It's virtually unknown. But here, it destroys more than 500,000 families every single year. And this all loops right back to Timothy Snyder's central point. He put it so powerfully. He said, when I was too sick to talk, I didn't have freedom of speech. When I couldn't move my body, I didn't have freedom of assembly. It's such a profound idea, isn't it? Our health, our actual physical bodies, they aren't separate from our liberty. They're the whole foundation. Your body is literally the vessel that holds all your other freedoms.
So, let's connect the dots here. We've got survival being treated as a purchase, we have care being denied by an algorithm, and we have the fundamental idea that health is the basis of all freedom. When you put all that together, you get to a pretty startling place. This isn't just another debate about policy. It's much deeper. It's a constitutional crisis right at the bedside.
Think about the U.S. Constitution. Right there in the preamble, it says one of the goals is to promote the general welfare. So my question is, how does that square with a system where your ability to get life-saving care depends entirely on how much money you have or what insurance plan you can afford? A system that decides who lives and who dies based on price. That's not just inefficient. It feels like a direct contradiction, a failure to live up to one of the most basic promises of the Republic.
And that leaves us with one final, huge question. We talk about freedom like it's this big, noble idea. But really, what is freedom if your ability to live, to breathe, just to exist can be wiped out by an algorithm in 1.2 seconds? What is freedom if it can be denied by a claim number?